Greetings to all of you, distinguished stakeholders online and here in Geneva. We have progressed a lot yesterday, both in the drafting mode, but also in discussions, both informals in the evening, and also we had a very enriching discussion with stakeholders to see how best we could engineer or re-engineer the way we interact with stakeholders. And then we will discuss what we have collected as suggestions with the members of the IGWG to see if they are in agreement for those that were not able to join us in that meeting with stakeholders. And let me just summarize that we capture first that there is a continued desire to really observe fully the exercise. So there is this request, still waiting to see if the current state of play could be somehow be modified or turned into an acceptance of this presence as observers during the whole time with the members of the IGWG. Number two, maybe trying to, as an experience, as a pilot, try to shift from early morning where very few stakeholders, very few members are here to interact with stakeholders. So it ends up being mostly Bureau members and stakeholders, which is not the main purpose of the exercise, because we would prefer for the members also to either react or also ask stakeholders their opinion, because most of them are resource people that could help us in our deliberations, and clarify also any points that have been discussed during our sessions. So we will see, for example, if the membership would agree that tomorrow, instead of holding a 9 o'clock meeting, we will hold a 4:30 meeting right after our deliberations, and maybe if the members agree, we could start at 9 o'clock drafting and go all the way to 4:30 to best use our time. So this is still pending consideration from IGWG members. There was also a call for us to be a little bit more explain a little bit more of the contents of what we are putting in the text. Stakeholders have access, for example, to the on-screen text, as we yesterday went through section 2A and B. But then for them, and not us not being allowed to identify who proposed what, they would just try to understand what is the broad way things are, the direction of the discussion. So we will then also consider that with the members today as we begin our work to see if they agree to that. There's also a call for having more than one interaction, and we said that it would be difficult for us, Bureau, because we also need to meet ourselves. We have the informals, but we would try to see how best we could interact with them in addition to these briefing sessions, maybe in the afternoon if the members agree, and some interactions during lunchtime as well that were considered in order to increase this interaction with the stakeholders. In any case, there were also specific requests to include for example, the contribution of lawyers and those that have legal knowledge or technical specific knowledge in our deliberations, so that we would not do something that would not take into account what these resource people might have to say or flag as a contribution. So the interaction was a lot more richer than what I'm summarizing, because I don't want to take too much of the time, but it was a perception that both all stakeholders expressed this need to have more access to what we are trying to deliberate before it's too late, because sometimes they just see as ex post mode, and then they want to be able to help us or contribute or be alerted before things are crystallized into a text and then not easily modified. And it was an opportunity also for the Bureau to convey the importance of having them with us in a manner that respects the members' also decisions, and we would continue in this interaction, but always based on what the members of the IGWG are able to decide. I will allow then Matt to continue so that we can discuss today what we have done yesterday in our drafting. Please, Matt.
Thank you so much, Ambassador Tovar. Good morning, everybody, and also to those online. Firstly, thank you to relevant stakeholders for the excellent and helpful meeting that you've already described, Ambassador Tovar, yesterday. It was greatly appreciated, and I found it incredibly helpful, as we always do, with your input. Just a few words about what we discussed yesterday and what we're going to discuss today. We had a very helpful go through the text in terms of part 2 of the text, which is the provisions for implementation of the PABS system, both on the operation of the system and access to PABS materials and sequence information. Just to say a few points on that, clearly equal footing is something that's been raised by a number of delegations, and of course there's lots of interlinkages between what we're talking about in section 2 and what we've already talked about on part C and PABS system benefit sharing. A lot of the focus we had yesterday was actually, and we had as always the support of the Secretariat and WHO team, is looking at actually a lot of questions on how do databases work at the moment, how do laboratory networks work at the moment, and what could be envisaged in going forward as part of the PABS system. A lot of focus on the unique persistent identifier, that both in terms of the PABS material and the sequence information, and actually sequence information and PABS materials, is it always the same approach? Is it not? A question to talk through. Really good to build on what we've already seen from the written statements and written contributions from IGWG members over the summer and beyond, but also just to sort of enrich our understanding of each other, but also the technical side of what works and doesn't work. In terms of the discussion for today, we'll have a similar sort of textual discussion in terms of the benefit sharing, building on what we have already discussed. I'm sure one of these key issues we're going to discuss again is the issue of other participants, users, I think as you said yesterday, Ambassador Tovar, various terms that have been proposed for that, but how do we ensure a system that it works for participating manufacturers, for the universities, for the individual researchers, in a way that ensures the system is most effective? So I think that's probably all I'll say at this stage. I don't know if you want to add anything before we open the floor for comments.
Thank you, Ben. I think it's best to see how stakeholders were able to appreciate the text that they have received, although I understand it with very little time to reflect on it. We're also dealing with the fact that we do want to speak a bit more directly to stakeholders, but I understand that our sessions are webcast, so we also are under that kind of a situation in which in order to preserve, the contents of what we have discussed, we're really not allowed to go beyond stakeholders. Unfortunately, this is how our methods of work indicate to us. So maybe we will have to see how best to have this interaction more meaningful with stakeholders only. And so this is something that we still need to see with the membership. So that's why before we proceed to all of these adjustments, we will have to operate as we have been doing for this session this morning. So please understand that. And as we said, we will try to extract from the membership something that could be meaningful, different, more intense, but respecting the concerns and the indications that we may receive from the members. So we open the floor to see if you are aware of what we did, but also the fact that we will continue in section 2 today, trying to see if there is an interest and room, if everybody accepts, to do the same what we did with A and B with C, with benefit sharing. This still has to be discussed with the members as we begin our work, but the idea would be then to try to finish the first reading or consideration of the whole of section 2 by today, so we could tackle governance at some point according to our program of work. The floor is open for comments, please. Namibia, please.
Many thanks, Co-Chair. Good morning, and good morning to the membership. We just wish to seek clarity, Co-Chair, on your opening remarks with respect to this session with stakeholders. Was the intention that the Bureau wishes to only engage with stakeholders this morning, or would you also entertain interventions from member states?
Thanks so much, Namibia. And yes, and to be really clear, this is a meeting for relevant stakeholders, but absolutely, member states can absolutely speak as well.
Many thanks for that clarity, Co-Chair. In that case, if you will indulge the Namibian delegation just to share some reflections, please. Many thanks, Co-Chair. We thank stakeholders for their valuable inputs so far this week. We wish to address the concerning interventions from some stakeholders that attempt to weaken the PABS through what was framed as technical clarification, but constitutes systematic dilution of our operational framework. The claim that PABS definitions are scientifically confusing fundamentally misunderstands our purpose. On metadata as separate or redundant, Chair, this reveals a dangerous misunderstanding. A genetic sequence without context is scientifically useless, in our opinion, for emergency response. Excluding metadata would create a fragmented system where provider countries share biological intelligence but receive no benefits from the contextual data that makes it valuable. Globally, the scientific community has been advocating for standardized metadata, and African scientists have been systematically creating standardized metadata for cholera, sepsis, malaria, and mpox, notwithstanding other priority pathogens that need to be addressed. It is also crucial to remind everyone that metadata that includes location data needs to be balanced against the stigmatization of vulnerable communities. And as such, we are advocating for a minimum set of metadata that will ensure that DSI can be used for public health intervention when time is a critical parameter, such as in the case of an outbreak. On control being unrealistic, we do not support the false choice between quote-unquote no control and perfect control. During COVID-19, we tracked millions of genomes in real time and managed complex vaccine supply chains. If we track global financial transactions, we can track pathogen materials. The issue isn't technical capability, it is political will. Registration and traceability are not about controlling pandemics. They are about ensuring that those who provide materials receive fair benefits from their utilization. Co-Chair, we've heard all users should share benefits, but which benefits? Pointing to CBD categories puts the cart before the horse. How will we enforce benefit sharing obligations if we cannot identify obligated users? Benefit sharing without traceability is unenforceable. Co-Chair, benefits can be shared is not the same as benefits must be shared. And so we do not support voluntary approaches disguised as benefit sharing frameworks. In closing, Namibia supports transparent engagement with stakeholders, but cautions against undue commercial influence. We cannot allow those who benefited from COVID-19 extraction to shape rules correcting those inequities. Technical clarity serves equity when it enables enforcement. Technical confusion serves extraction when it enables evasion. We know which outcome this intervention promotes. I thank you, Co-Chair.
Thank you so much, Namibia, and yeah, your views have been heard clearly, so thank you for raising that. I'm conscious of time, and we just have now, I think, 14 minutes left for stakeholders, so I will not comment any further at this stage, but thank you, Namibia. Who would like to take the floor, please?
Anyone online? No, we can just...
We have, thank you, always very grateful to the first speaker. Third World Network, please.
Thank you, Co-Chair. This is regarding the document shared to us, relevant stakeholders, by the WHO Secretariat on the study on current pathogen genomics data. We just want to point out some difference of views. There are views which says some of the databases are globally open repositories. We really do not think they are globally open because it is subject to their policymakers' decisions. It's not guaranteeing open access across the world. It can, their funders have history of shutting down access to certain certain regions. Perhaps this particular database might not have been affected, but the databases under their, the entities who host this database has similarly shut down other databases, right? And then there is a view that certain databases are controlled access databases, but a better phrasing would be protected open access, which has been the way some governments funding that database has been calling those databases, not necessarily a controlled open access. Not necessarily a controlled access platform. And we think the document critically missed this question, which is whether whether there is a contract or a working relationship between WHO and these repositories. Otherwise, how are these repositories going to serve the purposes of the PABS or WHO? Because we see, for example, one of the two of these databases being recommended under PIP framework. But when an access to a scientist is denied unilaterally, or when an access is denied to a certain region unilaterally, where should that region go? What can WHO help in that situation? These are questions we need to address if the PABS have to guarantee open access. So therefore, we still continue to request IGWG to consider a working relationship with databases using contracts. Otherwise, we are not going to guarantee open access. Simply having databases across the world is not open access. Thank you, Co-Chair.
Thank you so much for World Network, and yeah, indeed databases was part of the important discussions we had yesterday, so thank you for your views. Anybody else like to take the floor, please? This is where my eyesight is not quite... Is it John Hopkins, I think? Yes, thank you.
Thank you very much, co-chairs. I want to build on the comments that TWN just added around databases and how they're currently perceived. I think there are worthwhile other norms to look to see what regulatory procedures and regulations, regulatory procedures in terms of use that existing databases that are described as open repositories currently comply with. So, for example, what biosecurity regulations do these depositories share information, require metadata, currently trace and track downloads and user data, including things like IP addresses when there aren't user registration. I think that that's a really useful normative comparison. So I think unpacking what are these other regulatory layers may open up pathways for thinking about, just as we hold security in high regard and biosecurity in high regard, how there may also be equity considerations that could be lifted to the same level of normative consideration. Thank you.
Thank you very much. Leibniz Institute, DSMZ, please.
Hi, good morning, everyone. Thank you, co-chairs. I believe that perhaps some aspects of the comments from the Namibian delegate might have been reflecting on an intervention that I had made on Monday, particularly on the aspects of the definitions of the PABS system. And I really appreciate the comments if that is a correct interpretation. The reason that metadata, in my understanding, is significantly different than materials and information is because of the frequency with which it is repetitive. So to give you an example, if you have a patient sample, you might put on that sample a number of metadata aspects. So that sample is very unique to that patient, but the patient's metadata would be highly repetitive. And I gave the example, that patient might be female. They might have pneumonia. They might have a runny nose. I mean, you wouldn't write that in a medical file. And they might be overweight or underweight or whatever. And much of that metadata will be highly repetitive across a population. And so that's much less unique than that very specific sample. And I was suggesting that one might create where you have in that list, you might have a definition for materials, a definition for information, and a definition for metadata, which will not have the same level of uniqueness or the same type of scientific manipulation or hands-onness that you would with materials and information. And therefore, I was suggesting that it plays a fundamentally different role in how data in scientific management is structured. And I'd be very happy if we had more time and more dialogue to be able to engage on that topic or to explain in more detail. Thank you again.
Thank you very much. I'll just give it another 10 seconds if anybody else wants to take the floor. If not, we'll wrap up with a big thank you to our relevant stakeholders for the engagement, and we'll take a 5-minute break now. Thank you very much. Sorry, Médecins Sans Frontières have asked to take the floor. I'm not sure if it's in the room or online. Online, please.
Yeah. Sorry, Chair, Co-Chair, for late raising the hands. We just want to thank you for sharing the text with us, and we are still reviewing the full text, but we would like to make one quick comment in regarding to paragraph 8.1b. So there are certain different options given in the negotiation. And we, from our very quick and preliminary review, we do support the consideration of requesting the participating manufacturers to sign the contract and agree on the legally binding terms and conditions prior to access to past material information. For us, this gives more certainty and guarantee to ensure that when outbreak happens, the anticipated benefit will be quickly shared, particularly for the timely real-time supply to WHO. So we want to share this for consideration. Thanks.
Thank you so much. And now we have Seppi. Lots of late requests today. Seppi, please.
Thank you, Co-Chair, and we add our thanks to the Bureau for sharing the draft text of the PABS. I think from Seppi's perspective, especially from the perspective of rapid vaccine development in response to an outbreak, I think we want to share our reflections about the importance of considering the role of access to samples and role of access to sequence information. I think to emphasize the point that access to sequence information is particularly critical for kickstarting rapid vaccine development through the design of immunogen, which is accelerated by the use of AI. And then this immunogen design can be paired with rapid response technology platforms, including mRNA, viral vector, and recombinant protein to start the production of vaccines for clinical testing. Access to materials, on the other hand, including clinical isolates, they are particularly important for the development of immunological assays for vaccine testing and understanding the immune response of infected patients. And of course, there are biosafety and biosecurity considerations, especially related to the requirement of infrastructure and capacity. So this required the IGWG to engage appropriate resource persons to address the sections noted by the Bureau for further discussions. But in summary, I think this could be considered by the IGWG as the IGWG negotiate the text. And in summary, every element of the PABS need to support the rapid, systematic, and timely sharing of materials and sequence information to expedite R&D for medical countermeasures at all the times, but also the equitable access to the outputs of such R&D. And that's our initial reflections based on the text. Thank you.
Thanks so much, Seppi. I'm afraid I now have to close this part of the meeting, but many thanks again to everybody.